You can turn it.
This one.
Yeah. Okay. Hello everyone. We are at ICM 2025 and could you please introduce yourself?
Yeah. Thank you for having me. I am Dr. Rajashekaran, Chairman and Head of the Department of Orthopedics and Spine Surgery in Ganga Hospital, Coimbatore, India. I'm also the Chair of the Executive Committee of the Spine section for the ICM this year. So this is a great privilege for me and thank you for the opportunity. Thank you for having me. Yeah.
Why the infection matters?
Well, I think if you ask any surgeon, irrespective of whether he is doing joint replacements or spine surgery or trauma, one most important thing that can kill a good result is infection. And infections not only spoil the whole operation, but it's very painful for the patient, leads to poor outcomes, it leads to many more surgeries undefined, increases the hospital number of stays, and also increases the cost tremendously. So I think the topmost thing in every surgeon's mind is infection prevention. And this is the same whether you're in a very developed country or a developing country or in a place where cost doesn't matter or in a place where cost matters a lot. Infection is one of the most important things that everybody is worried about.
What do you think about the ICM?
Well, I think ICM is really a fantastic concept. You know, in medicine, we always keep talking about evidence based medicine. But you know, there are many, many aspects of medicine and surgical practice where you cannot have a randomized control trial. Sometimes the opinion of the experts actually matters as much, or I would even say in some of the aspects it matters more where a randomized control trial is not possible. So ICM is very unique where for all these questions, and these questions have been determined by a series of experts all around the world, and they have distilled all the important questions where there is no consensus, where there is no clear evidence in the literature, and where there is no surety of a proper practice. And this is very unique. And then we have gone in a scientific manner to produce the mesh terms, to look at good literature review, find gaps in knowledge, and then there are 800 people voting on opinion and a consensus statement. I don't think you can have it better because it's so scientific, it's really inclusive because it has brought international flavor. Anybody who's who in the infections are all here, and I think the opinion and all the everything that's going on here is going to matter quite a lot and influence our practice.
You already mentioned that the detail is about the ICM, but what is the difference of ICM compared to other meetings or congress? Is there any specific example for us?
Yeah, I think other meetings are more concentrated on one person's work and one person's opinion. So many times it can be biased. Many times it is the institutional practice. And sometimes, you know, although we say orthopedics is globalized, but what applies to one country may not equally apply to another country. You know, if you look at the whole world situation, the disease pattern is different, the cost provided is different, the infrastructure available is different, and the patient's expectations are different. So when everything is different, you cannot expect one solution. So most of the other meetings are talking about people expressing their opinions on studies done in their hospital or their institution and which is applicable to their way of practice. So that is a big problem in that. But ICM is completely the other side. You are taking up a problem for which no easy solution and a ready-made knowledge is available. And now you are getting people from all over the world practicing in very diverse conditions, and who are also practicing with various infrastructure, and now they are voting on what is applicable to everybody. I think this is a very, very unique system, and it's going to be really good.
Anything you would like to mention it?
Yeah, I think ICM also has to go on, it's not a one-time event. Because as our knowledge grows and as the science grows, our practice patterns and preferences and our opinion will grow. So I think ICM has to be periodic. And Javed and everybody has done a wonderful thing by making it periodic. And every time we are looking at fresh gaps in knowledge, and this is going to be good.
Thank you for your time.
Thank you, my pleasure. Thank you very much.